If you've ever started antidepressants, you've probably heard the same advice. Just wait, they'll kick in eventually. But what if waiting isn't the best option? Hi everyone, my name is Mattias Hartmann. I'm a board-certified psychiatric physician assistant, and I make videos on how to improve your mood. In this video, we're gonna cover why it's a bad idea to wait too long for antidepressants to start working and what to do instead. When starting an antidepressant, many people assume results will take weeks, sometimes even months. But there's something important to look for at the 2-week mark. A 2009 meta-analysis of 6,500 people showed that by 2 weeks, you should see at least a 20% improvement in symptoms. This early improvement is a key indicator of future success. A lack of improvement by this point could mean that this particular treatment needs to be changed in some way by either increasing the dose of medication or changing the medication altogether, or adding an augmenter treatment on top of the medication, and that's known as an augmentation strategy. The reason why is because if there's no visible improvement in the first 2 weeks, the chances of eventually getting better on that medication at that dose drops significantly. Each adjustment, known as a necessary clinical adjustment, or NCA, becomes statistically harder to make as time goes on, with eventual responders needing fewer of these tweaks than non-responders. So why wait if you're not seeing results? While you don't want to wait forever, over-tweaking or constantly changing medications too early can also prove problematic. Research shows that every necessary adjustment in the early stages can decrease your chances of finding a successful treatment by as much as 30%. In clinical trials for depression, early improvement was linked to fewer adjustments, and those with multiple tweaks had poorer outcomes. But it's not exactly clear why that is. For example, people that needed more medication tweaks had worse outcomes, but maybe they just had more severe cases to begin with. The key is finding a balance. Monitor your progress carefully at the 2-week mark, and if necessary, consult your medical provider about adjustments. Just don't wait too long or change things too fast. Consider factors like dosage, side effects, and whether you're remembering to take your medication consistently every day, or if you're forgetting some days. Sometimes external factors like missing doses or drug interactions could be the reason for lack of progress. Remember, the goal is to find something that works for you without waiting in vain to see improvement. Sometimes getting pharmacogenetic testing, which is where your saliva is tested to look at your genes and how your body reacts to certain psychiatric medicines, might be a good idea. In fact, a recent 2022 meta-analysis of over 2,800 people showed that using pharmacogenetic testing to guide treatment for depression increased the likelihood of a full recovery by 85%. Now, while medications can work great for some people to improve their mood, sometimes there's an underlying medical cause of why someone is depressed. If you're interested in learning about that, click on this video right here on screen